Hey everyone, this is Dr. David Woman with Wage Regenerative Therapy, and I want to thank you for taking the time to go over this quick webinar in the next 10 minutes or so that you can understand whether Wage Regenerative Therapy is going to be a solution for your chronic or acute pain that is a musculoskeletal condition. So we're going to go over a few things and to determine, is this the right fit for you? So wave regenerative therapy is a revolutionary technology that can not only just eliminate your pain, it can actually help your body regenerate and actually have full function coming back. So it's not just about pain management, it's actually restorative and regenerative at the same time. So the three main questions I want to answer for you in this quick explanation here is one, why do you have chronic pain? A lot of people don't understand that they have chronic pain, but they don't know what the cause of the chronic pain is. Typically, they had some kind of trauma or injury of some kind, and it's just not resolving. And the thing is, it's not the pain that's the problem. It's that the pain affects our quality of life in such a negative way. We either have to avoid doing things we love to do, we can't do things as good as we want to do, and it really impacts our quality of life. Therefore, when we don't have quality of life, it is not as satisfactory, and we're always constantly trying to get the next solution so that we can get back to doing the things we love to do. The second question I want to ask is, why is it that everything you've tried so far hasn't solved your problem? Why hasn't it worked? There are reasons for certain things that work and why you're still here. And if you're here on this webinar, it's because you haven't found a true solution to your problem. So, from doing medications, physical therapy, chiropractic, and even surgery. But what is the missing link to this approach? I'm a chiropractor by profession, and how I got into wave regenerative therapy was that I actually had a shoulder injury that happened about 7 years ago. I was lifting too heavy and I tore my pectoral muscle, but it wasn't the pectoral muscle that was the problem, is that I actually tore my labrum in my rotator cuff. Over years of time, it affected me so much that I actually stopped seeing patients because just adjusting patients was too painful. I couldn't work out like I wanted to, and I couldn't play sports with my kids. So the quality of life was really frustrating for me. And that way I was always looking for solutions. So I tried like laser therapies, cryotherapies, you name it, I've tried it. But it wasn't until I found wave regenerative therapy that I was actually able to resolve my shoulder problem. I'm doing everything I love to do in life. And the great thing about this is I knew immediately after the first visit if this was going to help. The third question I want to answer for you is how wave therapy works, regenerative therapy works, and is this going to be actually a solution for your problem, and do you qualify? So before I dive into all the technology stuff and all this, I want to kind of explain to you why do you have chronic pain? So I'm going to draw this out for you. So when we look at chronic pain, the main thing we're going to look at, we're looking at muscles, ligaments, tendons, and cartilage. It's all the tissues that makes everything work. Now, if you looked at these tissues under a microscope, it looks like this. It's actually a webbing. It's elastic. When you bend and twist, things should bend and twist. That's the way the muscles, ligaments, tendons, and cartilage are supposed to work. Now, when we get a trauma, we can actually tear the fibers in here. So that's an acute trauma. Now, what if it's because of repetitive stress? Sitting at a computer too much driving, bad posture, sleep patterns. Well, best case scenario, your tissues have changed to something like this. They're a little wavy. They're stretched out. Now, when it's stretched out, the body says, well, this is weak and I don't like it. So what it wants to do is protect you. How does it protect you? It lays down scar tissue. You guys know what a scar tissue is. It's tissue set different. So the body will start to fill in the gaps for the scar tissue. Now, here's the problem with scar tissue. It's not flexible, which makes you prone to injury. So if you have an injury in the beginning, what's the first thing the body does is you're going to have a level of inflammation. So it lights you up. So what are most of the approaches we do? We do ice, we do ibuprofen, we do something to decrease the inflammation, which buys you a little time. Okay. The problem is when the scar tissue is not flexible and we get rid of the inflammation. So some of you may have done, like I said, the ice, the anti-inflammatories, or even done the cortisone shot. What does the cortisone shot do? It just decreases this inflammation right here. But the thing is, does it do anything for this scar tissue? No, That's why you still have a problem. It buys you time because the pain is gone, but the tissue is still damaged. The other thing we try is like physical therapy or chiropractic. And what that approach is to strengthen the muscles and ligaments around this damaged tissue. Buys you time. But the problem is over time, the more stress the body has, the more scar tissue it's going to create. And it gets to a point in time that the tissue is just not flexible at all. So every time you move beyond what this tissue can handle, it tears again, and then you get another inflammatory response. And then what the body wants to do again, let's add more scar tissue. So over time, every little movement you do creates these micro tears, which creates this level of inflammation, which is why you feel the pain. Now, the solution to this is not only to get rid of the inflammation, and this what ways regenerative therapy will do, but also to change this and reorganize the scar tissue. We want to get the tissue from here to here. Now, unfortunately, you'll probably never have perfect again, but there are degrees of good. If you keep doing what you've been doing, what is the body going to keep doing? It's going to keep adding more scar tissue. And over time, this can actually calcify. And you probably heard of people with frozen shoulder syndrome or really like extreme loss of mobility. That's one of the problems. You can do a little bit of treatment and feel good for a while. You can do what we call regenerative therapy, which is a 90 to 120 day process. Now, why 90 to 120 days? It takes the human body about 90 to 120 days to replace new tissue cells. So if you do anything physically, whether it's a weight loss program, an exercise program, if you don't do something for at least 90 days, your body's going to have temporary change, not permanent change. And this is where people play the roller coaster ride with their health because they never stuck through it long enough to actually make the drastic permanent change you're looking for. Now, tissue remodeling to get as close to here as humanly possible is actually a 12 to 18 month process. And those of you who've had surgery know this. If you've had shoulder surgery or knee surgery or hip surgery, it's usually about a 12 to 18 month process for your body to remodel those tissues and get it as strong as it can. So the goal is up to you to determine how far along this continuum you want to go. But we first got to see whether you even qualify for these things. So let's dive into some of these solutions. So we're going to look into the waves regenerative therapy, the shockwave stuff. So what is waves regenerative therapy? It's actually a non-invasive treatment. So it uses shockwave therapy to use acoustic sound waves. So it actually has an electric shock that sends a sound wave through water that impacts it into the tissue. And what it helps do, it actually helps stimulate new arterial supply to those areas. So it actually brings proper blood flow and supply to the areas so that they actually heal. Most chronic conditions is because the area is not getting enough nutrition again to heal. So that's a problem. The other thing it does with the acoustic wave, it actually squeezes out inflammation. So you feel relief pretty much immediately after a treatment because it's actually squeezing out some of the inflammation. But what it ends up doing is it stimulates stem cells, you know, those healing cells that actually help regenerate area, to focus and concentrate on that area again so it starts to heal again. Initially, when we hurt ourselves, the body wants to do that. We have inflammation, we have blood supply because that's why their inflammation is, and the body's trying to recruit some stem cells to heal the area. The problem is over time, the body has so many other things it needs to focus on. Your heart beating, your food digesting, your lungs breathing, that it's not going to prioritize that shoulder or that knee. What it'll do is add the scar tissue to create some stability so it can use energy to function on the more primal things that keep us alive. So with wave regenerative therapy, that acoustic stimulation actually re-triggers your brain to say, oh, I need to start healing that area again. Let's recruit more arterial supply. Let's create the stem cells to go on that. And it actually softens and reorganizes that scar tissue so you can get the flexibility back again. So that's what's great about that. Now, we have different types of shockwave therapy that we use. We have hydroelectric and electromagnetic. Now, it is very focused, okay? We can actually pinpoint into your area of your body to find where the damage is. We have a biofeedback mechanism. So using the devices that we use, we can actually you'll be able to tell us if that hurts or it doesn't hurt, because we can actually map out the area to say, oh yeah, that tissue is healthy, that tissue is not healthy, so we know where to treat. So it's very precise. The mapping is one part of the exam to see, oh yes, we have found the damaged tissue. A lot of people have had MRIs, they've done X-ray, they've done all this other type of uh, examination or imaging to find the damaged tissue. The nice thing about this thing is you can give you the biofeedback on where the scar tissue is immediately and if the tissue is damaged. If there is damage, you'll feel some discomfort. If there's no damage, all you're going to feel is like a tapping feeling. So that biofeedback loop is incredible. Plus, when we do the treatment on it, you can actually feel the intensity of pain decrease, because we're going to treat you around a 6 or 7 out of 10 on the pain scale. But once the tissues start to heal and the inflammation goes out, it's going to go down to a 4, 3 to 2, and you'll start to feel it decrease. So it allows us to have precise affected of the damaged tissue, not just a broad area like icing does or to all the tissues. We can really get into the areas that are damaged. That we have a high degree of adjustability because we can go deep, we can go shallow, we can go to your pain tolerance, because some people can take a lot. Some people, like myself, we're a little wimpy on these things. So we can be gentler and actually adapt to that stimulation so that we can get the therapy that's actually needed, because it improves your treatment outcomes, because we can tell how intense we should be or how light we should be based on your feedback. That way we can actually deliver the appropriate amount of care necessary to make the change in the tissue. Now, you're going to have faster healing. So it provides focused energy delivery, which translates to more effective treatments. Okay. Especially the chronic conditions where you don't have good blood supply, we can restimulate that arterial supply so you get blood supply and nutrition to those areas, because that concentrated energy is going to have a focal energy to heal that area. With this technology, you don't need as many treatments as some of the other technologies. So fewer sessions, you actually get great outcomes. And the patient satisfaction is great because we can tailor it to based on what your needs are and your pain tolerances. The other thing is, when you come into Waves Regenerative Therapy clinics, we're going to actually measure whether you have too much inflammation or not enough blood supply to the area, so that we know what the contributing factors are and the causes are. We use thermography. So not only do we have the biofeedback from the mapping, we are going to do a thermal scan of the affected area. Here's a before and after of a joint. And when we see green or yellow, that shows us there's not good blood supply to the area. When we see this orange or red, orange is good, red is a little inflammation, we can say, okay, that's where some stimulation needs to happen as well. But in this case, it was chronic pain. Now we did the treatment, and then after it turned blue, which is the most beneficial outcome. That means we squeezed out all the inflammation, so it cooled it down, which what we'll do in hand is bring back more arterial blood supply later on to create the healing process. So we can see that immediately before and after your first treatment. Now, this is backed by science. Okay. This technology has been out for a while. It's been out for over 20 years now. Now, initially it was made to break apart kidney stones. And it's actually a very known treatment for erectile dysfunctions, because it actually stimulates more blood supply to those areas. But you're doing something that's backed by science. It's non-invasive, and it'll give you confidence because you'll be able to feel the immediate outcome right away on the first visit. So why should you even try Waves Regenerative Therapy? One, it's cutting edge. Okay. It allows us to actually create the numerous benefits to your body non-invasively. Two, we have immediate biofeedback. So you're going to know on the first visit whether this will work for you. If you don't see any improvement, this is not going to work for you. Either decrease in pain, increase in range of motion. You will know after the first session whether this is a solution for your problem. And what we're offering today is, since you've watched the webinar and you've taken your time out of your day, schedule your appointment and you get 50% off the first initial consultation and first treatment for only $49. For $49, you get to find out, A, is this a solution to my problem? Or B, is there another option that we think is best for you? Because ultimately, we want you to get the results. Click the link below, schedule your appointment. It takes about half hour for the first visit, and we can find out if wave regenerative therapy can solve your chronic pain.